listening to that presentation, anybody who knows me will know that I was the child who was taught to fight. I was the child who was not loved. I was the child who was essentially troublesome. So when I speak in front of you this evening, I hope you get a sense of somebody who is actually very passionate about children's hospitals and passionate about the care that we give in them. I'm very grateful to you all for coming here this evening, and as Graham has already said, the environment that we're in presents, I think, really very obvious challenges to the launch of a major charitable appeal. And therefore to see so many people here this evening is really very encouraging indeed. I should say that as a Chief Executive of the NHS over very many years, the job that I do, I think, demands a very positive outlook, and I can tell you that I'm like the investment banker who irons 5 shirts on a Sunday night. I'm really an optimist, and I hope very much that you are too when it comes to this campaign. Now, there isn't anything I think that should make us feel more optimistic than the very exciting and immediate prospect of building a brand new children's hospital for the 21st century. And I know in Scotland in recent times some of our national aspirations to be world class have been somewhat dented, but I can't honestly think of a better way to reaffirm our ambitions than through how we treat and look after sick children and young people. And as Graham has said, we've all cherished with, I think, a huge amount of affection the current Royal Hospital for Sick Children, which was actually built in 1895. But anybody who goes there will know that it's becoming ever more apparent that the layout of that building and the fabric of the building are really quite huge constraints on that ambition. And there are also constraints, I think, more importantly, on the huge talent and commitment of the staff who actually work in it. And the new children's hospital that we plan to build will be the 5th in Edinburgh since 1860. And I believe very much that in our time of stewardship, we in NHS Lothian want to see a unique legacy for future generations of children and their families. Now, many people speak of aspiring to be world class, and we in NHS Lothian share that aspiration. We want to be at the level of Scotland's best in relation to healthcare systems, and among the world's top 25 healthcare systems. We're actually founder members of an international network which covers Europe, North America, Canada and Malaysia, and it enables us to back that aspiration with really quite tangible measures of how we're performing. But nowhere in what we do in NHS Lothian is that ambition more relevant than in relation to the new children's hospital. We want it to be truly world class. We want to see the expression of that in the space in the building, the design of it, the technology it deploys, and above all, in how friendly it is towards children. Now, in support of that ambition, NHS Lothian, together with the Scottish Government, will be investing £125 million in the new hospital. And I know that will secure a lot of really very excellent facilities. But the additional support that we hope to achieve from the new pyjama campaign will be key in ensuring that it is actually truly and demonstrably world class. From the outset, when we embarked on this project, we have involved children, young people and their families at all levels in the planning of the hospital. We've had extensive discussions involving hundreds and hundreds of children and their families in that dialogue. And I can tell you what they told us. They told us that they want a building which is open, which is outward facing and green, a building that enables and supports the continuation of children's daily lives, and a building which itself supports healing. For the children who are treated in that building, if you think of it this way, for the time they're there, that building will replace their homes, it will replace their schools, their neighbourhoods and their communities. And it's therefore essential that it needs to be innovative and flexible in design. And by way of, I guess, a topical and practical example of that, it's our intention, our desire to install a completely separate information network in that hospital, intended solely for children and young people, so that they can do the social networking, they can do the twittering with friends and family, they can learn and they can play without having to leave their rooms. And interestingly, in response to the wishes of parents and children, the building will have single rooms for every child over 8, which, as anybody who knows the current building, is a far cry from the existing arrangements. We also want the very best of technology to support clinical services and indeed clinical research. And the new hospital will be located at Little France, and it will sit at the very heart of the Edinburgh Bioquarter, which is now being created there through a partnership involving NHS Lothian, University of Edinburgh, Scottish Enterprise and an American developer called Alexandria Real Estate. And the Buy a Quarter will build on the reputation of the NHS locally and indeed the University of Edinburgh's Medical School, now recently rated as the #1 in the United Kingdom, to secure Scotland's position as a world leader in biomedical science and research. And I can tell you that over the next 10 years, Little France will become a global hub of medical and scientific innovation, bringing leading edge research from the laboratory bench straight to the bedside. If you look at the developments planned for Little France over the next 10 years, we will end up with a town the size of Galashiels on that site. And we absolutely want the new Children's Hospital to be an integral part of that. And to do that requires the most advanced technology. Now, some of you may have heard, amidst all the other matters to do with somebody's pension, of the new state-of-the-art scanner donated to us by the Royal Bank of Scotland, one of the only 3 of its kind in the world, and the first one in the United Kingdom. And to its credit, RBS have recently announced that this will now be entirely available for use by the NHS and the University of Edinburgh, and that's very much to be welcomed. But when the new Children's Hospital opens, we want it to have the same state-of-the-art technology. So, for example, in neurosurgery for children, we want equally advanced scanners, but we want the kind of scanners that are small enough to be embedded in the fabric of the operating theatre, so that the surgeons can have real-time images of the patient's brain without the child having to leave the theatre. Now, the Sick Children's Hospital also currently leads the way in Scotland on minimally invasive surgery for children, the kind of surgery that's done on a keyhole basis, the kind of surgery that minimises the amount of time a child has to spend in hospital and the trauma of that surgery. And Gordon McKinley, who's here tonight, is a world leader in that field. And we actually want services like his to have the very latest operating equipment so that children across Scotland, not simply in Edinburgh and the Lothians, can benefit from that match-up of clinical and technological excellence. But as well as the technology, we want to support families to make the transition from the hospital environment to the home, where ongoing care can continue. The hospital episodes are important, but what happens in the home on a continuing care basis is equally important. So we want to be able to provide much less high-tech space in the hospital, where families and patients can be given support to build their confidence in how care will continue beyond the security of the hospital environment. Now, my career in the health service sadly now spans over 30 years, and in that time I've been very fortunate in my career to have responsibility for children's hospitals across the United Kingdom, in Aberdeen, in London, in Manchester, Sheffield, and now Edinburgh. And I truly say to you this evening, we have a once-in-a-lifetime opportunity to build a children's hospital which will be a lasting beacon of excellence in the care of children and young people in Edinburgh, Lothians, and indeed in all of Scotland. And for those of you who may have any kind of concern in relation to the support you may be able to give, I have to tell you, for the avoidance of any doubt whatsoever, this will not be a PFI or a private financed hospital. It will be a hospital that belongs to the people of Scotland. And I believe with your support and the absolutely critical role of the new pyjamas appeal, that together we can build something for the benefit of children and young people, which will be the envy of the world. Thank you very much indeed for coming, and thank you very much for your future support.